Yes, it depends on what particular genetic condition is present in the family. There are two types. One is called dominant and one is called recessive. If it's dominant, it's more likely that it will be present. Depending on the type of abnormality, and if it is clearly described genetically, one could detect it in an embryo before implantation. But that obviously will need the following steps. One, clarification as to what is the genetic condition and if it has a recognized genetic mutation. Two, genetic counseling to establish the risk of this genetic abnormality occurring in the family. Three, genetic counseling to establish if a specific test exists to pick up this abnormality in the developing embryo. Four, establishing if pre-implantation genetic diagnosis with IVF, IVF is compulsory here, pre-implantation genetic diagnosis could identify those embryos that are affected and then preferentially transfer embryos that don't have the mutation, thus trying to have a child that does not have the genetic abnormality. Yes, this is a very general question. I wouldn't have a very specific answer to it, I'm afraid. The best person to advise you will be the physician that you see for your specific condition that requires medications. But just to give you an example, I have thyroid disease. Should I stop taking my thyroid medication? Absolutely not. If you have an underactive thyroid, you need to take that medication, and in fact, it ensures that you are healthy and also the child is not going to be affected. Let's say that you have an overactive thyroid, okay, an overactive thyroid. In that case, it's not indicated that you become pregnant for a little while. You need to take medication to slow down the thyroid, and then once that condition is well treated and your endocrinologist says it's okay to try now, then you could start trying, most likely after you discontinue that therapy. But the best person to advise you is the individual doctor that has recommended that therapy, and I think that's the best course of action. This is a challenging situation. Firstly, fantastic news that you've recovered and you're well. Nowadays, medicine and surgery, they're doing miracles, and believe it or not, 1 in 500 people are survivors of cancer currently living. The cancer that you had should not affect your likelihood to get pregnant unless you have no eggs or a very limited number of eggs. So you'll be a patient that would like to establish that everything is in order, both with your male partner in terms of sperm, but also with you in terms of uterus, if it's healthy, in terms of egg availability, in terms of ovulation, in terms of tubes, and so on and so forth. It also depends on how old you might be, because let's say that you are 47, then the choice is extremely limited, and most likely you might not have any eggs and you might need to look into donor eggs. Or you might be 24 and your periods have returned, and if everything else is in order and you ovulate regularly, your chance to conceive should be very good. So in terms of there are situations where women might have frozen eggs before, and I don't know if that is the case with you, but if you have frozen eggs and you have no periods and you have no eggs whatsoever, you can use the frozen eggs that can be now injected with your partner's sperm in the process called ICSI, intracytoplasmic sperm injection, and then the embryo is placed inside your uterus. Sexually transmitted diseases are a tricky area. Usually, particularly with one called Chlamydia, an untreated infection could have lifelong consequences, and it particularly affects the fallopian tubes. Either fixing them and scarring or closing them up, that means that sperm and egg cannot meet. So if you have been diagnosed with a sexually transmitted disease, it is imperative that you have antibiotic therapy yourself and also your partner to be sure that the infection is treated aggressively at the start and the long-term consequences are eliminated.